I supposed to go?
Go.
That's Max. Hello, my name is Rachel, and I'm going to be your student nurse today. Can you please state your full name and date of birth for me?
Julie Borger, 03/01/2000.
Thank you, Julie. So today what we're going to be doing is we're just going to be inserting this IV. And the doctor ordered an IV because you're going to have multiple blood draws, and instead of just sticking a needle in every time, we're just going to put in the IV. So what it is we just have a little needle in here, and the needle's going to help us get this plastic catheter in, and then once the plastic catheter's in, we're going to take the needle out. So there's not going to be a needle in your arm. You'll be able to move it around and things like that. Before we begin, do you have any questions or concerns?
Nope.
Okay, perfect. So I'm going to begin by setting up all my things. I'm going to put your arm on this. It's important that while we're performing this that you're able to follow my commands. So I'm going to have to ask you to hold your arm pretty still and maybe pump your fist and things like that. Do you think you'll be able to follow those commands okay?
Yep.
Okay, perfect. So we have your arm in a dependent position here. I'm going to raise the head here so we're in a comfortable working position. Okay. So then I'm going to just get my supplies ready. Wash my hands. Put on some gloves. Julie, you have tiny hands.
Want me to grab a bigger box?
No, it's fine. It will work. Okay, so now I'm just going to take this here. My alcohol pad. Clean for about 15 to 20 seconds, or agency policy. So. Just gonna take this. Make sure we get all of the air out of the line. I'm going to loosen the cap here so I don't have to fumble around with it when I'm perfect. And our line is primed. Just going to lay this here so I'll be able to access it easier. I just got our needle. Put that over here. Got my Tegaderm here. Just going to open that up. So it's all easy to go. Here. Okay, perfect. So now, remove my gloves. I'm going to grip up this. My hands. When in doubt, wash your hands, am I right? Okay. So I'm just going to apply the tourniquet. You already have your arm in a dependent position. So our things are up here. I'm going to apply the tourniquet about 15 to 20 centimeters above where I'm going to do the IV insertion. Now we're looking for a vein that is prominent, straight, and it rebounds upon palpation. So when I push it down, it comes back up. It looks like we have a good vein here, far enough away from the joint. So I think that's the spot we're going to use. It's important that when the tourniquet's on, it's not too tight and blocking arterial blood flow. So I'm just going to check a distal pulse. I'm going to check the radial pulse and make sure we still have arterial blood flow. The tourniquet can't be on for more than 2 minutes. So if it was on for longer than 2 minutes, I would need to take it off and let the patient have a break from the tourniquet for at least 1 to 2 minutes. And then I could put the tourniquet back on. So I'm going to wash my hands. Get some tape ready. Put some pieces here for me. Put on some gloves. my alcohol pad here. And I'm gonna clean the vein in a circular motion, starting in the middle and then going about 2 inches out for about 15 to 30 seconds or per agency policy. Then I'm gonna let that dry without blowing on it or waving it with my hands. So then now that it's dry, I'm gonna grab my needle here, bevel up. I'm gonna pull the skin taut with my thumb. I'm gonna go in at about 15 to 30 degrees till I see a flash. Once I see a flash, I'm gonna make it parallel, going in about another 1/2 centimeter. And then I'm gonna just hold that needle still, slide my catheter all the way in. Then I'm gonna withdraw my needle. I would put the safety on, grab this, connect it. Now that that's connected, I'm gonna withdraw my tourniquet. I'm gonna open this up. I'm gonna give the saline flush while holding that so it doesn't move. So now that we've confirmed we're in a vein, I'm going to close that, not saline lock it yet. I'm gonna grab a piece of tape and secure this so it doesn't move on me. There we go. Now I'm gonna finish my saline lock here. Tegaderm. Apply that right up to there. LOL. Good one, Rachel. Okay, now I'm gonna place my Tegaderm. So it's not covering that cannula, but so it comes right up close to it. Making the end dirty. Okay. Then using this extra strip here, I put the date, the time, the gauge of the needle, and I would sign it, initial it. Put that right there, per agency policy, whatever the agency needs me to put on there. Okay, so then I am going to, now that I have the saline locked, unscrew this. And then I'm gonna grab another piece of tape here. Secure this up here, wherever the agency would like it to be. The way, not flopping around. Okay. If there's any blood, I could clean it up. I'm gonna remove my gloves. I'm gonna wash my hands. If I was doing this on a kid, I could use a smaller gauge needle, let them see the supplies first. For older adults, I might not want to use this tape. I could use paper tape instead. Yeah, so I'm gonna make sure my client's bed is low, the call light's within reach, they're comfortable and safe.